The zygomatic bone is an important bone of the viscerocranium because it forms part of the orbit and because it relates important muscles of dental occlusion, the masthead and the temporalis. It is formed by a single body from which arise three processes, delimiting four borders that are included between them. The zygomatic bone has three processes. Superiorly, the frontosphenoidal process that relates to the frontal bone, forming the frontozygomatic suture. It contributes to forming the outer part of the orbit. Posteriorly, the temporal process articulating with the zygomatic process of the temporal bone, forming the zygomatic arch at the temporozygomatic suture. From the zygomatic arch originates the masthead muscle, and below the arch transits the temporalis muscle, tendon that heads toward the coronoid apophysis of the mandible. The zygomatic arch also forms a bridge between the anterior and posterior regions of the skull. Anteriorly, the maxillary process which relates to the zygomatic process of the maxillary bone, forming the zygomatico-maxillary suture, another origin of the masthead. The zygomatic bone has several borders. The posterior-superior one, called the temporal border, between the frontal and temporal process of the zygomatic bone, important because it presents the origin of the anterior bundle of the aponeurosis of the temporalis muscle. The postero-inferior border or masseteric border, from the maxillary process to the temporal process of the zygomatic bone, and is continuous posteriorly with the inferior margin of the zygomatic process of temporal bone. The anterosuperior or orbital border is between the lateral and orbital surfaces of the zygomatic bone. It represents the outer part of the orbit. The antero-inferior or maxillary border is the articular surface for the zygomatico-maxillary suture. The inner face of the zygomatic bone is concave and shows us, superiorly, the point of union with the frontal, forming the frontozygomatic suture just between the zygomatic process of the frontal and the frontal process of the zygomatic, contributing to the formation of the outer part of the orbit. Medially, the point of union with the greater wing of the sphenoid, with which it forms the outer part of the orbit, here is the sphenozygomatic suture. Inferiorly, it joins the maxilla, via the orbital surface of the maxilla. Remaining in the inner face, behind the orbital border, we can observe the insertion point of the anterior bundle of the temporalis muscle. The zygomatic relates to the branches of the maxillary nerve, particularly the zygomatic nerve, which divides into the zygomaticotemporal nerve, which passes through the zygomaticotemporal foramen and enters the temporal fossa, and into the zygomaticofacial nerve that passes through the zygomatic facial foramen. On the orbital process of the zygomatic bone, we see the zygomatic orbital foramen, which opens into the zygomaticofacial and zygomaticotemporal canals.